Hello, everyone, and welcome to the Convo presented by Leadership Indianapolis. I am Ebony Chappel, Manager of Programs and Communications, and today I am talking with Dr. Darrin Johnson, who is the Executive Director of BU Wellness. Hi, Dr. Darrin, how are you?
I'm good. How about yourself?
I'm doing great. I'm so happy to be talking with you.
A-
For
Absolutely.
people, yeah, for people that are unfamiliar, I know BU Wellness is the new moniker. It used to be Brothers United, but for people that are unfamiliar, tell us a little bit about your organization.
Oh, yeah, absolutely. So, BU Wellness Network is the only organization, it's a community based organization, but the only organization in Indianapolis whose mission is to serve Black people living with HIV and for HIV prevention. So, we have a host of services. HIV prevention services, HIV counseling testing, support groups, CDC endorsed evidence-based prevention programs, a number of ways to engage folks living with HIV, linking them back into care, and also preventing new infections from occurring in our city.
And this incredible work that you all do. I'm such an admirer of you and of the organization. Help us to understand why this work is so critically important, especially now. Everybody knows COVID, right? We're dealing with the COVID crisis and the COVID pandemic. And there are so many layers of it that seem very reminiscent of the AIDS and HIV crisis. Tell us why this work is so critically important in the city of Indianapolis.
Absolutely. So, as you mentioned, like COVID and any other chronic condition, HIV disproportionately impacts Black people, right? So we look at the rates of new infection, specifically in Marion County and its immediate surrounding counties. Black people, get or acquire HIV more so than any other population. And when you look at the services for the community and who's doing work to address this HIV epidemic within the community, there are not that many people and there are not that many organizations focused on tackling this issue. And that's what our organization does. I mean, we make sure that we are getting out in the community, letting people know what HIV is, that it still exists. We're getting people to talk about HIV, within their families, within their friendship groups and faith communities, with youth populations. And when you think about people living with HIV, and you look at the younger age groups, youth categories, they are the age group who's least likely to reach viral suppression, which means that they're not in care, they're not taking their medications in order to become what some people know is undetectable. So it's important for us to continue to talk about this and address this issue. In fact, in early 2019, the president's administration, put out this call to action for the nation, where we, as 57 jurisdictions and 48 counties, and Marion County is one of those, we are to create a plan to end the HIV epidemic in 10 years, so from 2020 to 2030. And we've been working with our community partners to develop those plans to make sure that we are engaging communities to talk about HIV in the most effective way possible. In saying that, now that we're dealing with COVID, right, and so many other syndemics, people impacted by substance use, people impacted by diabetes and heart disease, in addition to HIV and now COVID-19, we understand that as an agency, we just have to tackle healthcare in Black people, period, right? But understanding that we are an HIV organization and we're going to continue to be rooted in taking care of communities living with HIV, particularly Black communities living with HIV.
Yeah. And during COVID, you all are used to being on the streets, in the communities, right there with people. And this time has kind of prevented a lot of that. How have you and your team managed through this big transition?
It's been hard, but it's been good though, because we sort of operate in a hybrid model, right? And what's interesting about this organization is and the people we serve, I mean, we're resilient people. So we were already flexible. It was like, okay, this is what it is. All right, we gotta, make something happen. So I think when COVID hit, I had to make a difficult decision to pull back our services and not have engagement like many other organizations, and particularly healthcare organizations. But understanding that we're serving Black communities who are impacted by HIV and now COVID and all these other things, we can't totally shut down. Like, that's not an option. So we were already, doing community outreach, like face to face and in the community, and having community engagement events. And we were also doing work on social media already and engaging communities that way. And we just had to figure out how to enhance that online engagement. And that meant that, there was a level of training for our staff that they, had to quickly go through to say, this is what we are, already doing, but this is how we can do it better. And if you're going to be working from home, this is the way to do it. And we had to purchase new equipment so the staff can be effective at working from home. And as things started to ease up, we had, one of our departments, our prevention and care department, come back on site to make sure that we were able to get folks in for HIV testing and STI screening. But our care and retention department were able to continue to engage clients from home with calls, with Zoom calls, WebEx, and Google Meets. So we continue to operate in a hybrid model. We continue to, go out to the community when we can to provide HIV testing and prevention education. And that looks like also providing personal protective equipment, also known as PPE, to the community, where we're wearing it, we're giving it out to the community can wear it, we're taking it and giving it to them so they can take it home to their families. We've been able to distribute over 3,000 masks to the community. We've increased our access to to our food pantry. So we've been doing a lot of things in COVID because, again, shutting down was not an option for us.
And, this work takes a lot of work. It takes a lot of hands. It takes a lot of involvement. BU Wellness is one of over 100 nonprofits that are featured in our Get On Board 2020 nonprofit guide. What are you all looking for when it comes to committee members, board membership, just people to get involved to help continue the work that you all have been doing?
Absolutely. So I think the important part of that, this conversation, is that we are about to launch our new strategic plan. It's a 3-year strategic plan where we have made some slight changes to our mission. We have created our vision, and it's a real direction on where we need to go as an organization. So in understanding that, folks who come on board to support our organization have to understand that, this is a Black space, and we're rooted in taking care of Black people in the context of, managing chronic conditions and just overall health and wellness. So that's one. Two, we are in transition in terms of our board. We've had board members to serve for a very long time, getting the organization to where it is now, and understanding where we're going. And, we are looking for new board members to serve, serve and take us to our next level. And volunteers as well, right? Like, we want people to, one, help us spread the message about, HIV awareness, HIV prevention, taking care of families living with HIV and individuals living with HIV. But two, how do we manage through this process? Like, how do we manage through COVID in this pandemic? Because even though we might see increases in rates here or decreases there, because of its impact, communities of color, particularly Black people, are going to feel the impacts of this for a long time. And that's something that, we as a community don't necessarily think about. The financial impact, the physical, emotional, and mental impact of this pandemic. So we want supporters and volunteers to know who BU Wellness Network is, what we do, support us that way, helping us spread the message. But if you come on board as a volunteer or a board member, there are a number of opportunities to serve and take us through our strategic plan and get us to that next level.
Fantastic. And beyond, needing a lot of hands on deck, this also requires leadership, visionary leadership. And one of the questions that I love asking when we do these interviews to local leaders in the community are the leadership lessons that helps inspire them and inform how they operate. So, Dr. Darrin, what are some of those things that have helped inform the type of leader that you are currently?
So, first, I think my leadership style is more so transformational. So I like to really engage people that I work with. And we have to understand our starting place and sort of our vision and where we want to go, and work together to take those steps and see the transformation for whatever project, organization, community that we're working within, right? And what I realized, especially in the midst of this pandemic, is that nothing's really changed for me. I just noticed how resilient my staff are, our communities that we work in, how resilient we are as a people, right? Because we were able to shift quickly and take care of each other and take care of our communities. And what I learned is that for me personally, it took a lot of patience, right? So I come in and I like to, observe, but at some point I got to go and make sure that we take those steps to get things done. But I had to, constantly take a step back for my own mental sake, right? And make sure that I do those check-ins with my staff to make sure that they are good and they can meet their deliverables and they can engage community. And then, we do these check-ins with our community members. We host a virtual drop-in center. We still operate our support groups because we want to make sure that our folks are good. So, I learned that, we continue to be resilient no matter what is thrown at us, right? We're already taking care of the HIV epidemic. And then here's COVID. So we're in the midst of this sort of international, this pandemic, right? And we were able to quickly change and answer the call. And we're still working on that because, of course, we're not doing everything right. This is, lessons learned for us. And we'll continue to make modifications as we go as an agency. But two, for me, it took a lot of patience to be able to step back and make sure that, I'm taking care of my people in the best way that I can. And I'm still learning the best ways to do that, from my colleagues, from, I check you out on social media and I see that, you're just such a bright spirit, right? Like every time I see you make a post or have these type of conversations, it's reassurance for me that I can certainly do this. So I appreciate you, and I appreciate you checking in with me and the organization today.
Absolutely. You're more than welcome. And I feel the same way. When you came to town, I was just like, thank God, please stay, because we need people like you. So I'm grateful for this time that we've had and grateful for all the work that BU Wellness Network is doing in the community. So thank you. And thank you to each and every one of you for tuning in to the Convo. Have a great day and a positive week.